When a patient is first referred for transplant, the first step that must be taken is contacting their insurance directly to get authorization for an evaluation for transplant. This is done by the Transplant Fiscal Department. Their job is to not only contact the insurance company, but to verify the patient's insurance and to get an authorization needed for the patient to be approved to come for evaluation. Once a patient is approved for evaluation, they will be scheduled for a week-long full of appointments, follow-up testing, everything that's required in order to completely evaluate them for transplant. During that week, they will meet individually with each member of the team, including myself, the social worker, a nurse coordinator, a surgeon, a transplant pulmonologist, a nutritionist, as well as the fiscal department who will go over their insurance coverage, benefits, all of those things. They are also required to attend a pre-transplant orientation class, which is held each Monday, and they are required to attend that with at least one caregiver who will be with them throughout the week and will make a commitment in terms of their ability to be their caregiver post-transplant. The patient will work very closely with both myself and the nurse coordinator. The nurse coordinator is responsible for managing the patient's medical needs, medical data, testing, appointments, all of that. I work very closely with the patients for social resources, things like where they will stay, what their caregiver plan is, and insurance questions. If the patient lives further than 4 hours from the transplant center, they can relocate to Pittsburgh. They can stay locally at Family House, which is an organization, a facility that allows patients to stay close to the hospital, which also has a shuttle service which is available to them and can help them to get to and from the hospital. Post-transplant, patients are required to be within 2 hours of the transplant center. Again, many patients stay at Family House post-transplant as well. Patients that come from other countries have a variety of resources available to them to help them to navigate the transplant experience and the evaluation. They will each be provided an interpreter in their native language who will follow with them throughout the evaluation process and develop a one-on-one relationship to really work with them and help them to be an advocate throughout the process. At UPMC, we work very hard to make the evaluation and transplant process as individualized as possible. We understand that it can be overwhelming, there's a lot of information, and we work very hard to work with our patients on a day-to-day basis to help meet their needs. If a patient is transplanted at UPMC, they will follow up with us for life. We will forever be their transplant service, and we will always be available to them.